Welcome to the PHS Overdose Management for Opioid Overdoses. My name is Shannon. I am a nurse for the Portland Housing Society, and we wanted to touch on this important issue today. As you can see from the scale, OD deaths have increased from 1989 to 2015, and they are steadily increasing. There have been 755 overdoses and counting from January to November 2016. That's a 70.4% increase since 2015. 19 to 49-year-olds account for most of the OD deaths, and most of them are males. It's also been known that deaths occur from Saturday and Sunday. Vancouver, Surrey, and Victoria have had the most number of overdoses, and Fraser Health Authority has had the highest number, which is counting at 259. VIHA had the highest rate, 19.7 per 100,000 people. Opiates and opioids. Opiates are naturally derived. They consist of heroin, morphine, opium, and codeine. Opioids are synthetic, and they consist of hydromorphone, oxycodone, fentanyl, methadone, and Percocets. How long do these drugs last in the system? They come in two different strengths, the long-acting and the short-acting. Long-acting is methadone, which occurs from 24 to 36 hours. They are slow-release oral morphine, for example, Cadian, that lasts 24 hours. And then Suboxone, which lasts 24 to 36 hours in the system. The short-acting is fentanyl, heroin, and morphine that lasts from 30 minutes to 5 hours. Methadone is very popular. It's a full agonist, and it can be a risk of overdose, especially when people are using benzos and alcohol. Methadone is an easy-to-start medication, but takes a long time to get to a therapeutic dose. You usually see people start at 30 milligrams, and it can be increased. The medication can be increased from 10 milligrams every 3 to 5 days. It requires a daily witness program from the pharmacy or a nurse, and it's harder to get carries. Buprenorphine and naloxone makes up Suboxone. Suboxone is a partial agonist. It sticks to opiate receptors very tightly, and it still acts on the receptors, but not as much as full agonists. A person won't feel effects of opioids on Suboxone if it is at a therapeutic dose. This medication is more difficult to start because a patient has to be in withdrawal first. To reach the therapeutic dose takes 1 to 3 days, and it also decreases the overdose risk. It is easier to get carries for Suboxone because it contains naloxone, which is less potential for abuse and use. Benefits of methadone and Suboxone. Research shows that methadone and Suboxone decrease HIV transmission, criminal activity, other opiate use, other drug use, injection-related risk behaviors, other risk behaviors for STI transmission, and a mortality rate. It has been shown to improve quality of life. Methadone has better treatment retention, but it has been around longer than Suboxone. Naloxone, Narcan, is an opioid antagonist which blocks the effects of opiates. It's very safe, It only works on opiates or opioids. So Narcan works within 5 minutes from being injected into a muscle, and a person can be given multiple doses. The effects only last 30 to 60 minutes, and it's possible to re-overdose after the effects wear off. Overdose risk. People can be at risk for overdose with a lower tolerance. For example, when they're first released from jail, detox, or the hospital. Overdose risk can be increased when people mix alcohol, benzos, or other sedating drugs. Drugs can be cut with fentanyl, or people can have other sicknesses like liver issues and dehydration. Okay. Opioid overdose versus a stimulant overdose. An opioid overdose is when somebody is nodding off, they're falling asleep, they have a decreased pulse and decreased breathing or no breathing at all. They're pale, their skin looks pale or blue, and it feels cold to touch. Their pupils are pinned or their eyes are rolled back, and they do not respond to painful stimuli. A stimulant overdose can mimic a cardiac arrest with no pulse or a very fast beating heart, short of breath, diaphoretic, or hot. A person can suffer from confusion, hallucinations, or even unconsciousness, a shaking or clenched jaw, seizures, chest pain, and cardiac arrest. Calling 911 is the best possible thing to do because this requires hospitalization. An opioid overdose response. To respond, 911 should be called. Next, to grab your Narcan kit and follow the Save Me steps. Save Me is an acronym for 4 letters. So when you find somebody that is in an overdose, you will quickly apply your gloves and stimulate. S is for stimulate, by giving them a sternal rub, a trap squeeze, calling their name, and applying your pulse oximeter. A stands for airway. You need to make sure that the airway is clear, and then you will insert your oral airway when you reach the back of the mouth. V is for ventilate. Head tilt, chin lift. You will use your ambu bag that is attached to your oxygen machine. You will give 1 breath every 5 seconds. You do not want to hyperventilate. You will use 15 liters of O2 with your ambu bag, but you also must squeeze the bag to get the O2 in, because the bag does not function as a face mask on its own. If you do not have an ambu bag, use a barrier mask, but always make sure to plug their nose. You will be watching for the chest to rise. E is for evaluate. Are their oxygen stats improving? Is their color improving? M is for muscular injection. You will draw up and administer 1 ml of naloxone. You will make sure that you flick the top of the vial to make sure all the Narcan goes to the bottom of the vial. And E is for evaluate and support. You'll continue to ventilate if no response from Narcan is administered within 3 to 5 minutes. You will stay with the person, continue to ventilate until they begin breathing on their own. E is for evaluate. Are O2 stats improving? Is their color improving? M is for muscular injection. You will draw up and administer 1 ml of Narcan. You have to make sure that you flick the vial so that all the Narcan is at the bottom of the vial. E is for evaluate and support. Continue to ventilate. If there is no response from the person after the first dose of naloxone, you will give another dose within 3 to 5 minutes. Continue to stay with the person and ventilate until they begin breathing on their own or the ambulance comes. Sites for injection of Narcan should be done in a muscle. This is a photo of the acromion process. We have a deltoid muscle, and that's where you would give your injection. We have a part on our leg called the greater trochanter, and it's a nice big muscle we have right here or on the side of our thigh that you could administer Narcan. Here's a poster of the Save Me steps below to respond. If the person must be left unattended at any time, please put them in the recovery position. So S for stimulate. If they are unresponsive, call 911. A for airway, head tilt, chin lift. V for ventilate, 1 breath every 5 seconds. E for evaluate, check their color, check their breathing. M for muscular injection, administer 1 ml of Narcan and continue to provide breaths until the person is breathing on their own. Again, E to evaluate, do they need a second dose? If no response after 3 to 5 minutes, give another injection while waiting for the ambulance. Narcan summary. Just to remember that Narcan only works on opiate overdoses. The effects of the Narcan will wear off after 30 to 60 minutes, and it is possible to re-overdose. You cannot harm someone by giving Narcan. And for more minor overdoses where the person may be somewhat responsive, it is best to monitor. Some minor overdoses can be managed without Narcan. Some overdoses will require more than 2 doses of Narcan. And when someone overdoses, please encourage them to go to the hospital or have someone check in on them if they refuse to go. Wake up. Buddy, wake up. Are you okay? Let me give a sternum rub. He's not responding to the sternum rub. I'm going to get my gloves on. Put the pulse oximeter on his finger. Turn it on. You will see a pulse rate and a number that shows the saturation, the oxygen saturation. A pulse rate could be high, it could be very low. And the O2 stat could be very low. Remember, oxygen is more important than Narcan. You're going to do a head chin tilt. You will have your airway. You want to point your airway to the sky. You're going to open the mouth and put the airway in and flip it at a 180-degree angle to keep the airway open. You are then going to take your ambu bag from the bag and place it on the oxygen tank. You will see a section where this part can attach. You want to administer 15 liters of this medication. On the top of the oxygen tank, you will turn till you see the number 15. You will place the ambu bag on top of the person, creating a big seal, a tight seal. You will administer 1 breath every 5 seconds, gently. If you are by yourself, you will let go, or you will delegate this task to someone with you while you draw up the Narcan. This is Narcan. It comes in 1 ml vials. Always get help from the people around you. Kim, can you come help me?
Sure, what do you need?
I need you to hold this mask on this person, creating a tight seal. I want you to give 1 breath every 5 seconds while I draw up the Narcan. This is your Narcan. You want to tap the vial to make sure that all the medicine goes down into the bottom. You will hold the tip of the Narcan with 2 fingers. You can open the vial by bending it towards you or away from you, gently. You want to put your Narcan on a flat surface, whether it's the ground or a table. You will take off the lid to your needle, insert it into the vial, and pull up all of the Narcan. You want to make sure there's no bubbles in the syringe, and you will insert this into the person's muscle. We will use this part of the muscle. The needle can go through the pants. We will pretend that this is his leg. You want to hold your needle at a 90-degree angle in a dart position and firmly insert it into the muscle. You will push down till you hear a click. And your needle will be retracted back into the syringe. You will continue to evaluate the person overdosing by checking their pulse with the pulse oximeter and waiting for the ambulance to arrive. Kim is continuing rescue breathing. And if there is no response within 3 to 5 minutes, we will draw up another Narcan to administer into a different spot of the body. Reminders. Do not hit, shake, slap, or punch the person overdosing. It will not help. Do not throw water on them. Stay with them when they come back up. And remember, Narcan only lasts 30 minutes. Replace your overdose kit and restock supplies after each incident. That's it.
You gonna come back to life? We saved him. Good job.
Fantastic, you guys.
Okay. Thank you. Thank you, Cole.
Great.